Ozone therapy treatment in dogs and cats. Ozone therapy consists of the use of oxygen and ozone in a therapeutic way. Among its effects we can mention the anti-inflammatory, immunomodulatory, antimicrobial and healing. The oxygen that we breathe is a molecule with 2 oxygen atoms, O2, while ozone is a molecule with 3 oxygen atoms, O3. In order to produce ozone, we need to break down the O2 molecules so that they reassemble as O3. There are several ways of applying ozone. The main ways are the local application of the gas, which can be done in acupuncture points or not, by intramuscular, subcutaneous or intra-articular route, rectal insufflation and major or minor auto-hemotherapy, when ozonization is done and then the patient's own blood is reapplied. Other routes, such as intra-discal, epidural, ozone bag, vesico-urethral insufflation, and fistula application depend on the case to be treated and are usually less frequent than the main forms. Ozone oils can also be applied to water for topical use, tissue cleaning, or even oral use. Animal ozone therapy is capable of reducing platelet aggregation, undoing red blood cell stacking, modulating oxidative stress, reducing the production of exuberant granulation tissue, improving local circulation and tissue perfusion, promoting wound disinfection and debridement, and stimulating healing and epithelialization. In addition, it has anti-inflammatory, antalgic, immunomodulatory, bactericidal, fungicidal, and virucidal effects. Ozone therapy can be indicated as a complementary or isolated treatment for several diseases. We can cite among other indications the intervertebral disc disease, spondylosis, osteoarthritis, tendinopathies, septic arthritis, discospondylitis, sepsis, osteomyelitis, contaminated wounds, urinary tract infection, fistulas and abscesses, pyodermites, allergic dermatopathies, papillomas, rheumatoid arthritis, chronic inflammatory intestinal disease, diabetes, chronic renal failure, ischemic diseases, treatment of wounds and bedsores, burns, chronic obstructive pulmonary disease, COPD, dry keratoconjunctivitis, chronic glaucoma, liver disease, neurodegenerative diseases, adjuvant in the treatment of cancer and to alleviate the side effects of chemotherapy. We must be careful with senile, debilitated, or severely stressed animals. In cases like these, ozone therapy should be avoided, or else done very carefully so as not to worsen the clinical picture of the animal. Remembering to always consult your pet's veterinarian.